Hi, folks. We are just about to get started for our meeting. People are being led in the Zoom. Thanks for joining us today. We'll give it just 1 minute before we begin to let everyone join. Right, it looks like the members of the public are in. So we will, I'll pass it to our Cali CH Executive Officer, Megan Marshall, to start our meeting.
All right, folks, thank you so much for joining us today, and I will give it to Giselle to get us started today with roll call. Giselle.
All right, I'll go ahead and call roll. Once I call your name, please say here or present. Apologies for any names that I mispronounced. All right, and we'll start with Ludmilla Bade.
Present. Good afternoon, everyone.
Thank you. Alba Estero. Samantha Batko.
Present.
Doug Bond.
Present.
Carolyn Coleman. Joe Coletti.
Present.
Charlene Dimas Peinado.
Present.
Dirka Eisen.
Present.
Dora Gallo.
Here.
Jennifer Hart Dietz. Eric Harris.
Here.
Chuck Helgett. Janet Kelly. Jody Ketcheside. Margot Cushel.
Present.
Philip Mangano.
Present.
Chris Martin. Mariah McGill. Luana Murphy. Alyssa Orduña.
Present.
Sharon Rapport.
Present.
Janie Roundtree. Emilio Sala. Miguel Santana. Doug Shoemaker. Sean Spear.
Present.
Reba Stevens.
Present.
Megan Van Sant.
Present.
Alex Vizovsky. Javon Wilkes.
Present.
Roxanne Wilson. All right, we have 9 people attending. We do have a quorum. I'll pass it on to you, Megan, for any opening remarks.
Looks like we may have lost Megan. Do I see her anymore? She may have dropped off. Okay, I will open us up then today. Apologies about that. We will let Megan back in as soon as she can. So welcome everyone. Welcome committee members and members of the public for joining us for this meeting. Thank you all for making the time to be here today. As you know, I'm Cody Ziegler, Director of Statewide Policy here at Cali CH. A few reminders before we begin. So this is expected to be a 2-hour meeting. And while we'll do our best to keep this time frame, there's always a possibility we may go over that timing slightly. Prior to this meeting, committee members were provided with a briefing packet, which is also available to the public on our website. We'll try to leave some time for committee members to ask general questions toward the end of the meeting, but if we run out of time, please feel free to reach out to our staff as always with any questions afterward. So the agenda for today, as you can see on the screen, we did the call to order. We will then vote on our consent calendar. And really the majority of our time today will be spent discussing recommendations that members of the committee have put together for the council, for the CalICH council on 2 specific questions that we spoke about at our last advisory committee meeting. So as you all may remember, volunteers from this group sort of met to discuss both improving state funding and programs, as well as developing statewide performance metrics. The result of these discussions are going to be recommendations to be shared with the council as they work to update and report on our action plan. So given these goals, we have a lot of ground to cover, and I just thank everyone in advance for their participation in today's meeting. And then during today's meeting, there will be an opportunity for general public comment. We will allow for a maximum of 2 minutes for each comment. We welcome all public comments and feedback. However, due to the structure of the public meeting we're in, we may not be able to respond to the comments. So for this reason, if folks, members of the public, have any specific questions that they would like answered, we encourage you to email us at calich@bcsh.ca.gov. And with that said, we're going to get this meeting started. So the advisory committee to the California Interagency Council on Homelessness is hereby called to order on August 14th, 2023 at 1:11 p.m. We did the roll call. So Giselle, can you move to the consent calendar?
Yes, I'll move us on to the consent calendar. This is agenda item 2. The consent calendar is for regular non-controversial items that need to be approved by the committee via vote, where we do not expect any discussion from members. That said, the committee may engage in discussion on any items in the consent calendar if members so chooses. We have one item, the adoption of the May 8th meeting summary. Are there any comments from committee members? All right. Before proceeding, since this is an action item that will result in a vote, we will now open it up to public comments. Please keep comments to the items on the consent calendar only. If your comment is not related to the consent calendar, there'll be time for general public comment at the end of this meeting. If you're connected through Zoom, select the raised hand icon in the meeting window on your computer. We will unmute your audio to allow you to comment. For those joining us by telephone, you may press *9 to indicate that you'd like to comment. And then once we call on you, would be instructed to unmute yourself. Everyone will have 2 minutes to make their comment. Just gonna take a second to see if there's any hand raised. All right, I'm not seeing any hands. Would anybody from the committee would like to motion to approve the meeting summary?
This is Vitka, so moved.
Thank you. Would anybody like to second?
Second.
Perfect. All right, since you have a motion to move it, I will call the roll for a vote. As I call your name, please say aye or yes. You may also abstain or vote no. And if any members are present after the roll call, please note that you're here. Thank you. All right, and we'll start with Ludmilla Bade.
Abstaining, no issues.
Thank you. Alva Esteros,
Aye.
Samantha Batko,
Aye.
Doug Bond,
Aye.
Carolyn Coleman, Joe Coletti,
Yes.
Charlene Dimas Peinado,
Aye.
Vitka Eisen,
Aye.
Dora Gallo,
Yes.
Jennifer Hartbeat, Eric Harris,
Aye.
Chuck Helget, Janet Kelly, Jody Ketcheside, Jody, I believe you're here. Margaret Cushell,
Aye.
thank you. Philip Mangano,
Aye.
Chris Martin, Mariah McGill, Luana Murphy,
Aye.
Alyssa Orduña,
Aye.
Sharon Rapport,
Aye.
Janie Roundtree, Emilio Salas, Emilio, I believe you're here as well.
Aye.
Thank you. Miguel Santana, Doug Shoemaker,
I abstain. I was not on last time.
thank you. Sean Spear,
Aye.
Reba Stevens,
Aye.
Megan Van Sant,
Aye.
Alex Vizovsky,
Aye.
Javon Wilkes,
Aye.
and Roxanne Wilson. All right, we have 19 votes for, so the meeting summary passes. Thank you all. Okay, we can move on to the next agenda item.
All right, great, thank you. And thank you all. So moving right along as promised. So today's agenda has really two main agenda items, right? And they're each meant to discuss the recommendations that have been put together around the two questions that we talked about at our last meeting. So during the last advisory committee meeting, we began the discussion on improving state funding and programs and also developing statewide performance measurements. And again, those who were interested in continuing this work were able to come together to synthesize the comments that we heard from the full committee and create sort of a draft set of recommendations for the council. And that's what we'll discuss during the meeting today. So we'll start with the recommendations developed for the funding and programs, and then the next agenda item will move to the ones developed on performance measurement. So on the next slide, you'll just see a reminder of the question that we asked you at your last meeting, just to refresh your memories, right, that the smaller group sort of followed up on. And so that was, how can the state better align funding and or coordinate across programs to improve their collective impact? How could the state streamline or improve access to funding? And what are other ways the state could strengthen the impact of funding and programs? So to present the draft recommendations around this question, I'll actually hand it over to Alex Vysotsky, and then we'll jump back in to sort of help facilitate the discussion. So Alex, you can take it away.
Sure. Thanks, Cody. Appreciate that. Yeah, so I think as you'll see in your packet, there is a section that in about a page or a page and a half kind of summarizes what everybody in the work group had to say. We tried to break this down into really kind of three sections of feedback that came in. And those three sections were one, kind of looking at how Cal ICH could reduce administrative burdens for applicants for funding. The second section was really focused on how do we strengthen capacity among funded entities and their service providers with an eye towards advancing equity. And the third section was looking at, how do we make changes to how state funding is structured? So these are pretty broad buckets. So I think you'll see not everything necessarily fits super neatly in there. But this first section really looked at, ways like a unified funding application, such as, we see on the affordable housing side, that might reduce some of the burdens and reduce some of the duplicative actions that grantees have to make to apply for funding. Some more in the weeds things on, the audit side. How do we consolidate audits across multiple programs? A big thing I think that came up was aligning with federal funding sources, things like timelines and reporting requirements that are similar, but not always exactly the same, that lead to folks kind of having to reinvent the wheel. And then a big thing that came up was also kind of the multi-year funding application. And this came up again in the form of ongoing funding. I think folks are seeing having to kind of duplicate and do the same applications year after year without significant changes which kind of prevents folks from being able to focus on, being able to scale up their programs and being able to focus on the performance of their kind of sub-grantees. So there was a strong kind of desire for multi-year funding as well. The next slide, please. Thank you. So this piece is really focused on how do we strengthen capacity among the funded entities, and how do we use funding as a way to advance equity. So there were a number of kind of instances here where we talked about the way funding is awarded to grantees that kind of creates these situations where grantees are forced to kind of float the costs of their programs while they wait for kind of reimbursement of their costs, and some of the challenges with that model and with the cost reimbursement model of funding. There were also kind of some discussion around lowering some of the barriers to, culturally sensitive providers being able to access funding from counties, cities, and COCs that access state funding, and what can the state do to kind of incentivize some of the local jurisdictions to lower these barriers. Again, another big theme was also how do we use funding as a way to lift up people with lived experience of homelessness and in decision making among grantees, and how do we ensure that stipends, appropriate compensation is being lifted up here. I'll move to the next slide, please, as well. All right, and on this last piece, I think the big couple things that came up were, looking at, recognizing that some of these things can't be done administratively, but encouraging our partners at Cal ICH to advocate to their administration partners and to the legislature to look at ongoing funding, or at least multi-year funding cycles that allow for more planning, more investment in things like housing interventions that actually end folks' homelessness, and that would of course make it easier for local jurisdictions to actually administer this funding by focusing less on the administration. So there's definitely some overlap between some of these categories, but that's kind of like the 3-minute overview, I think, of what was many more minutes of great work group discussion. So Cody, hopefully that satisfies what you're looking for.
Great. Thank you, Alex. Appreciate you leading us through those. And thanks to the whole group, right, who helped put those together and sort of refine as time went on. So we have sort of two goals for each of these discussions, right? The first is to make sure, right, like, add or clarify pieces of this, like make sure we feel good about these recommendations as they move to the council. And the second piece is to say, figure out sort of like what questions do we have for the council members regarding these recommendations, right? So the discussion at the council meeting can really be a two-way discussion, right? They can ask questions about the recommendations, and sort of we can ask questions, the advisory committee members can ask questions to council members, right, about like sort of moving forward with these recommendations. And then the last piece, which you will see at the end, but just to put in your minds now, is that we will be asking for someone to volunteer to sort of present this section of recommendations to the council at their meeting in September. So put that in your minds, think about it as we have the discussion. So just want to open it up to advisory committee members now. See, we have a couple of discussion questions, but feel free to sort of bring up what's coming up for you. You should all have those, the sort of the full set of recommendations and the summary that Alex mentioned and just went over in your meeting packets. So feel free to raise your hands and I can call on you. But the discussion questions we have here, right, are sort of what additions or clarifications would you want to make to these recommendations before they go to the council? And then again, what questions would you have for council members regarding these recommendations? And our team is actively taking notes, so we will be doing that as well. I see Sharon, you have your hand up.
Hi, thank you all, and thanks, Alex, for giving that overview. I think it looks really good, and I was, really pleased to see the conversation captured so well in the notes, so appreciate that. I had a couple of questions. One is under action area 2 on page 3 of the notes that you all sent out. One point included expanding the count of people experiencing homelessness to include people in hospitals, jail, and other institutions. And I would have significant concerns with that because at any one point in time, that can be a huge number of people, and the vast majority of those people will not become homeless. I think what was meant by that point was not to include all people who are, people in hospitals, jails, and other institutions, but to make sure that the definition of homelessness includes people who were homeless when they entered an institutional setting and are likely to be homeless when they exit. So I just wanted to make that clarification because I do think that that's an important distinction, and I think we don't want to say all people who are in hospitals or jails or other institutional settings, because that is a huge number of Californians. But I do think kind of preparing to prevent people from becoming homeless again, if they've been homeless before they were in an institutional setting and they have nowhere to go when they exit, is incredibly important. So I do want to respect that point, but also think the way it's worded may not capture what was meant by that. The other point I just wanted to make, and I think we had a brief discussion on it in one of the work groups, but I didn't see it included in the notes. I do think that we severely underfund services and property management in California. And so if there's some way to capture kind of a recommendation around really looking at the actual costs of what services and property management should be if we were serving, a high acuity population, which I think most in terms of like supportive housing, most supportive housing right now is serving a high acuity population. And when we look at the evidence behind the really good results around supportive housing, most of the studies looking at existing programs are paying much more for services and probably property management too, but certainly for services than we currently fund. So I do think it's important to somewhere capture that in terms of really advancing equity that we really need to be looking at in terms of rates of services and for any kind of property management, that we really are looking at what the actual costs should be and paying for those costs, and what the evidence is telling us the intensity of services needs to be, and capturing that somehow. So I didn't see that mentioned, and just am wondering if it's possible to add that as a point. Thank you.
Sharon. And before I see Doug, I see your hand as well. Before we move on, does anyone from the group of folks who put together these recommendations have any thoughts about that? Any other thoughts about the suggestions Sharon made? Ludmilla, I see you raised your hand.
Yes, first of all, I really want to thank Alex Vitosky for the excellent work he did on consolidating it. And I know I helped a little bit, but I had to turn it back over to him to finish up. Thank you so much. Looks great. What Sharon Rappaport brought, I thought that's an excellent thing. And yes, I do see a need where in our area as well for just that would be great. That is needed. Want to make a comment just on the one line about expediting, like the reducing instances for awardees and their funded service to float the cost. I think that would read better if we just said to expedite payments and reimbursements to awardees and their funded service to reduce the float time and costs. just to make that a positive statement, because it's not intended to penalize the awardees. It's just intended to expedite the payment so that there's less kind of lost time in there. Thank you.
Great, thanks, Isabella. And yeah, just as a clarification, we're just currently talking about the implementation of funding and programs recommendations, not the performance measurement recommendations yet. So just want to put that out there. Sharon, I think that the first comment you made was related to the a recommendation in the performance measures, if I'm looking at it correctly. But feel free to clarify if that is not correct. Doug, I see your hand went down. Did that answer your question? Okay, cool, great.
I think
yeah.
it was, I'm sorry, Cody, I think it was under the implementation of funding programs. But you could be right. It could be that the first comment was under performance measurement. So apology.
No, that's okay. We can take the comment and apply it where it is. So no problem about that. Yeah, Luana, I see your hand up.
Yeah, I just want to second everything that she said because it is so true. We talk all the time about the barriers for people not wanting to come in. And many of them are related to there's not enough funding to lower those barriers to allow the services that will bring the people in. We need to look at what the real cost is for sure. Thank you very much for saying that.
Great, thank you, Luana. Vika?
I just wanted to add to Sharon's comments, which I think were really important. There's all kinds of complexity when you try to calculate the true cost of providing services. And often what happens is the funder will say, okay, well, what is it? What have we paid you? That's what it costs, which fails to account for things like unfilled positions because the salaries have fallen below any kind of market rate. And so when we talk about what is truly paying for the cost of services, meaningful services attached to housing, we need to consider kind of a more complex way of looking at that also allows for cost escalators over periods of years and doesn't kind of freeze you into this is a 5-year contract, this is the dollar amount over 5 years, and it doesn't change despite the cost of living going up.
Great, thanks for that. Any other thoughts or comments about the recommendations in this section? Any additions or clarifications folks would make? Great. Okay, just moving on to that second discussion question. Any questions you would have for council members, right? As we bring them these recommendations, right? Anything that you would want to know from them about, how is it that, like, what avenues do we move these forward through? How do they respond? Any questions they have, et cetera? What sort of discussion would you want to see with them? Alex?
Yeah, I think there's was pretty clear consensus among folks in the work group on a few key points. Multi-year funding, what are we doing to lower administrative barriers and streamline programs and have a more kind of comprehensive approach that's coordinated across the board. I think we should be asking council members, like, what are you all going to be doing to advance that? If there seems to be kind of broad agreement there, both administratively within your departments and in bringing your resources to the table in the council, but also, the council members all play a pretty strong role in being able to drive legislation and respond to legislation. So what can you do to kind of push the legislature on that too?
Thanks, Alex. And Megan?
I Are we still on, I'm trying to respect your process, Cody, are we still on the implementation of funding and programs, or have we
Wait.
moved to, what are we, where are we?
We're still on the funding and programs, yeah.
Okay. Then I'll hold my other part till we get to the performance measurement. I think I'm not sure if this is exactly what Alex was saying, but so I'll pretend like I think I know what he's saying. If you're asking how do we communicate this to the council, I do wonder if, like, we have a nice list here, it's all true, but if we really emphasize a few things, and I do think multi-year funding, or really I would say permanent ongoing, I don't even know if I would say multi-year, permanent ongoing funding could be a highlighted theme. I feel like in the state programs, the positive is that there's a clear acknowledgement at the state level that this is an expensive and complicated issue to solve around homelessness, but they keep doing these one-year things. And I know that the spending timeline is long, but they're just, an application each year that doesn't match with what we all know is true, that this is a decade long, probably 20 years, maybe more. We could start with 20 investment. And it would just be much easier for all of us to do this work if there was just that acknowledgement on the financial side as well. So I'm thinking if the communication is out of all of these, the thing that to me is most important is that multi-year ongoing, really honestly permanent mindset around funding.
Right. Okay, that's helpful. So it sounds like both Alex and Megan, you're feeling like maybe having some prioritization of these items or marking some as like, here are the top things we all agreed on from this set of recommendations, right, could be helpful in prioritizing what the council members are seeing from this. We can definitely work on that and find a way to sort of not remove any recommendations from the list, but maybe highlight the ones that feel like top priority, like you all are saying. Does that sound like what you were recommending? Great. And just one note, so these recommendations are wide ranging, right? They're expansive in a positive way. I think one thing for the committee to know as we're bringing recommendations to the council is like, what role do council members themselves and their departments have in pushing forward each of these recommendations? I think, as Alex mentioned, right, like some of it is maybe direct in the work that they're doing via their departments or agencies. Others might be more recommendations or influence in the legislature as it comes up, right? And so I think one question I think that came up in from listening to you all talk is like, what avenues are there to push these recommendations forward? So I think we will include sort of that in a list of discussion questions as well with the council. Any other thoughts or questions that you all would want to hear during that discussion? Or thoughts about this section in general? I see Ludmilla's hand. Ludmilla, you're still muted.
My bad. I was
You're good.
almost there. Yeah, also on page 2 of this of the overall summary on the second attachment, that's where I'm going from. Just at the bottom, just where it's got like support the unique needs of different communities. I really think that those should be almost like 3 separate items or split, because those are such different categories of action, of concept. Fostering community buy-in is like one thing that's really helpful. Peer support programs and other workforce development programs is another super helpful thing. Those are both like things that are on the ground with the communities that are going to make kind of relatively low cost, but will make a huge difference in connection and success going forward. And then the third thing, just separate planning efforts to reduce permitting times. That the whole discussion with a permit department on permitting, just permits and permitting times, that's a whole other conversation with different folks than the other ones. So just bullet pointing those separately or at 3 separate things or something that just for clarity, rather so they're not all clumped. Thanks. Yeah, appreciate it.
Thanks, Camilla. Reba?
I believe I have a question. Wanted to be clear about. This is in the second part around the awardees, reducing instances for awardees and their funding by floating the costs. And so I was curious if, with this, because there's a word here that really got my attention, and it's lengthy gap, not just a gap, but a lengthy gap between the awards and the execution of the contract. And so just curious, how does that affect, the work that's ongoing? Because I keep thinking about, and truly in great support of ongoing funding, which I believe is truly critically important, especially when we're looking at these contracts. So my question would be, how does this affect the work for those who are providing this, where these gaps are concerned? In other words, does it affect the work that actually touches the people? And does it challenge or create problems for the morale in the workplace?
Any committee members want to respond to that? Feel free to just unmute or.
I can respond. I mean, I think Reba is all of the above, but everything you just said, I haven't had any experiences with the state, but certainly locally too. I've had contracts as long as 6 months, right? And so it really puts a financial burden on the provider. Some are able to manage it, borrowing or using their own funds, and some are not. And by not being able to manage, it really excludes some of the maybe smaller organizations that could have provided services if the funding was in place right away. So it has, it has moral impacts, business impacts, financial impacts. It's all of the above, which is why I thought this was a really good recommendation. That one resonated with me. I actually put a check mark right next to that one. Of course, that meant I printed it out, but I printed it out and I put a check mark instead.
I would just agree with Dora that, and to Reba, I think it's both. I mean, the lengthy gaps between award and execution of contracts impacts the organizations who are willing to do this work. And then because of that, it impacts the clients we're trying to serve. And I do think if there could be, I do think there's a little bit of a chicken and the egg. If there's a multi-year funding commitment, I work in county government, we would be more comfortable doing multi-year contracts. As it is, we're doing these like lame year-long contracts, sometimes 9-month contracts to service organizations, and it takes us like 6 months to get it done. So if I was a small nonprofit, I'd be like, I'm not sure if this is worth it. It's too stressful. It's too confusing. I can't count on this money. I'm afraid to hire somebody because then the county might just flake out and not, renew my contract. So I do think it has a real world impact on the work being done on the ground. And again, it makes it a little bit harder from the county's perspective as well to monitor these contracts well. We'll get to the end of a contract and we'll be like, well, that didn't really work very well, but we only did it for a year and we were responsible for some of the delays. So it makes it harder for us to hold our service providers accountable in a fair way. So it all, to me, falls together as a problem. I think that the delay in the gaps between award and execution happens at both the state level and the local level. We're really slow and lame ourselves at the county level, and the state sometimes is pretty slow as well.
Great, thank you both for responding to that.
So if you don't mind,
Yeah, please.
Cody, thank you for the responses. And I'm just thinking that it is important to not only the language that's there, but to uplift the challenges, the consequences, and how it affects. And I think it should be called out. It should be named. And so that would be a recommendation.
That's helpful, thank you. Any other thoughts on this? Before we move to our next section of recommendations. Yeah, Joe?
Yeah, Cody, when I heard you say move on, I figured, oh, I'll just throw this out now real quick before we do. Because as I'm hearing us talk, there's so much that we feel that's important, that needs to be said. And we go back 10 minutes and 15 minutes ago in this conversation, we were talking maybe one or two things or so, should, be stressed, and then the others should follow and so forth. But, a lot of those, there's so much. I mean, when the multi-year funding applications, sure. But remember when we talked about unified funding applications, just how about, because, and then we talked about consolidating the audit requirements and aligning timelines, particularly with the feds and HUD and everything. And so what I'm thinking of is that, especially when we talk about aligning with the feds and everything, part of our charge as a advisory committee is to, make the council more and more aware of what's happening at the federal level, so that what's happening at the state and federal level can dovetail. So like even when we get into systems performance measures, right now, a lot of the state legislation is saying, hey, let's use HUD's systems performance measures, why? And everybody's involved in that. So, again, and so somehow, even when I say all of that, it sounds like it's so much to say, but and I'm not just saying this because we came up with some especially some of us came up with some really great ideas. It's just there's a lot to say here. And and I think we want to say to the Cal ICHs, no, you should do this. You need to do this, not consider, I think, anyways, I'll stop there, but I just wanted to say that before you went on.
Yeah, thank you. And that's why I said we were gonna move, because I was like, maybe someone else will jump in. Appreciate it, Joe. Any other comments, any other thoughts? Okay, if something strikes you as we're talking about the next section, don't worry, feel free to bring it up. We can always scroll back up our pages and make notes. So keep thinking about it. Now my favorite part of this piece of the discussion is we are hoping to find one person to volunteer to present these recommendations to the council. Other folks obviously may join in the discussion or answer questions from the council, but we're just hoping that one person can sort of like run through the recommendations. The plan is to include these recommendations in the council meeting materials. So the council members will have them in advance of the meeting. They'll have time to review them. But it's, of course, always helpful to go through during the meeting and sort of do what, talk through the recommendations with them live, just so we can get the discussion started. And then other folks, of course, can sort of join in to answer questions or to be part of that discussion. As far as the council meeting goes, it's going to be on September 7th at 1 p.m. It is going to be an in-person meeting in Sacramento. However, if that does not work for you to attend in person, we are going to hopefully have a way to, have virtual participation as well. So that should be okay. I see Doug's hand up.
Sorry, Cody, I just had to step away for a second. Have we already talked about the performance measurement section? No, we
Not
haven't.
yet.
Okay,
No.
all right.
No, we're just looking for someone to volunteer to present recommendations to the council on the performance side of the recommendations. And then we'll do the same thing for the, not performance, for the programs and funding. The words do get mixed up, so sorry about that side of it. And then we'll do the same thing for the performance measurement next. So we are going to let you all self-organize a little bit here and figure out who is comfortable or interested in just sort of running through these recommendations with the council members.
Cody, what day was it
Go
again?
ahead.
It is September 7th at 1 p.m. I believe.
He has his hand up, Cody.
Oh, Joe, I'm sorry. Do you have your hand up? I missed that. Apologies.
I think it was up from before, Cody.
Oh, from before. Okay.
But I think that's probably a volunteer move. If somebody can't put their hand down, that means they're the presenter. I think that seems like a good form of self-government to me.
All right, then I hear a nomination for Joe. Joe, do you wish to respond? You're muted if you're
Yeah,
trying
no,
to type.
I'm so sorry.
No, you're good.
You know what? I was multitasking for a moment and I forgot to put my hand down. I was going to volunteer Alex, so I think he beat me to it, but no, first of all, let me get my lower my hand. Get that done. No, I think I think Alex is leading the charge. Hey, Alex.
I would love to do it, but I unfortunately cannot come to the September 7th meeting, as I'll be out of town. So I don't know if one of our local government partners who is in the funding and implementation work group, perhaps Megan would be interested.
Well, I appreciate that, but I'm both not super interested, and I'm also not going to be able to be in person. And I do think it'd be really nice if whoever can do it can be in person. But thanks for the suggestion.
I have to verify if I could get a babysitter. If I could get a babysitter, I'll do it. So give me 24 hours, Cody, and I'll let you know.
Yay, Roxanne. Yay.
Amazing. Anyone else interested? Of course, Roxanne, we would love to have you. So happy to have you doing it if you're able to. Ludmilla?
Okay. Do I dare to do this? Yeah, this is completely scary for me. I want y'all to know. Okay. But is what's required, but I'm thinking here. This could be pretty amazing to actually meet some of you in person. Is what's required basically a review of the item like Alex Fatosky just did in this meeting? Okay. And you'd help me with questions from everybody, right? Okay.
Course, yeah.
Cody, what people would, and I'm not on my own. I'm not like in the middle and then everybody have to fix it all from there. Okay, good. Okay. Okay, so I'd be happy for other people to do this, but this would also be pretty amazing, actually, for me to make the drive from Sonoma County and get over there. So if I could be a backup for Roxanne, if she's not able to, that would be if you think I can do it. If y'all think I can do it, I don't want to just go on my own.
I say yes.
Okay.
Yes, I also agree. I have full confidence in your ability, Ludmilla. I'm happy to have you as an alternate. So why don't we follow up with both you and Roxanne after this meeting? Thank you both for volunteering and for your time. Also, for folks who would like to come but don't want to present, also 100% you're welcome to come. Would love to have you at the meeting, of course, either in person or virtually. So you're not required to present if you attend the meeting. Just want to make that clear. All right, great. And if anyone else, if the mood strikes after this and you're like, you know what, I do want to present, feel free to message me separately. All right, thank you all for that. I appreciate it. We're going to move on to the next discussion around the performance measures. So, oh, Megan, do you have another comment? Okay, I see for this one. Great, perfect. You're ready. So for agenda item 4, we're moving through the discussion through the agenda. So we'll move to a discussion of the draft recommendations made by members of the advisory committee around performance measures to use to better assess our progress as a state towards preventing and ending homelessness. On the next slide, again, is just a reminder of the question that we asked you all at our last meeting that the smaller group followed up on, which was how can the state best assess its progress on the commitments it's made in the action plan? What are other measures that we should look to in order to assess progress in each of the 5 action areas? Are there measures the state could be using to assess overall progress, which is something that we'll talk about? And then any other ideas for a strengthening state level performance measurement? So I'm just going to run through really quickly the recommendations that were made that we have here. So for action area 1, there was discussion around assessing how people with lived experience are included in the decision-making processes of programs, assessment of partnerships across systems. In action area 2, which is focused on unsheltered homelessness, there was recommendations around analyzing the adverse health impacts of COVID, opioids and substance use, and other factors for those experiencing unsheltered homelessness. Assessing whether communities have standard protocols or responses to encampments that mitigate sweeps or arrests of people using substances. Analyzing the number of unsheltered people moving into managed encampments and sheltered settings or placed into permanent housing. And expanding the count of people experiencing homelessness to include people in hospitals, jails, and other institutions, which Sharon, I think, is the note you made earlier. So we'll take that into account. For action area 3, which is around sheltering and interim housing, there was recommendations around assessing the length of time people spend in shelters and interim housing, analyzing the rate of successful exits from those environments compared to a determined baseline measure, and expanding data from clients to include coordinated entry master lists as well. In action area 4 around permanent housing, there was recommendations around analyzing racial disparities in access to permanent housing, analyzing how many permanent housing units need to be created, including unit production and rental subsidies compared to the current creation of units each year. And then last, for action area 5 for prevention, recommendations around analyzing outcomes from specific programs, including the number of people returning to homelessness after exiting to permanent housing, assessing the costs and investment received by clients through services and time spent with clients, and assessing the housing retention over several different time periods. So these were sort of the recommendations made initially. I don't think there's any. Okay, great. There was also a comment which was sort of an overarching comment across all of those action areas that we have in the recommendations around ensuring that we are looking at disparities, racial and ethnic disparities in the data for each of those data points that we're looking at, and making sure we're understanding what disparities exist. So that's more of an overarching comment. And I want to say, that I would say around these recommendations, right? Some of these measures already exist in some places. Some would have to be new sort of measurement or research. But I think the real thing we're trying to get to here, right, is what is the ideal way that we are sort of looking at our performance in each of these areas and then across the action plan as a whole, and understanding, like, are we making progress as a state, right? So whether it's us doing something as a council or council staff, or it's looking to external sources or research that is already existing, right? What is sort of the combination of things that we would want to make sure that we're looking at? And then just lastly, a note that for those who were able to attend the last council meeting, they heard this, but just as a note for those who weren't, Secretary Lourdes Castro Ramirez, who's a co-chair of the council, was really particularly interested in this question, right? Of like, how do we measure our performance? There were some comments made about the action plan that it feels very individualized, right? Like sort of disjointed, where like certain departments and agencies are reporting on their own programs or their own progress, but that to see the progress as a whole is really challenging, which I know is something that we all face and we all have faced in the past around reporting. But just want to put in an extra sort of plug here for if you have any thoughts about the second bullet point that's on the screen right now, right? Any ideas for additional measures to assess the performance of the action plan as a whole? That was a particular area of interest from our co-chairs. So I will stop talking, and I'm going to put these questions into the chat, and then I will sort of call on folks whose hands I see up. Great, Doug.
So I have a comment or a question that I think pertains to both the thing that you just asked about and the item related to action area 4 permanent housing. So I'm generally confused by what we mean about permanent housing and how it relates to other forms of residential care that we might be thinking about. And I am not totally sure I understand whether we mean permanent supportive housing in area 4 or all forms of permanent housing, or particularly permanent affordable housing. So the additional measures section, assessment of how many PH units are needed, feels like it needs deeper clarification if we're really going to ask it. And if it's permanent supportive housing, that's great. And then I think we need to then go a little bit further and think about whether that's really the only question we need to ask. And as we go back to the other piece, I guess the overall performance of the system, such as there is, I guess that is a broader question for me, which is, I'm currently struggling, or our organization is currently struggling with the fact that the referral systems that we work with through coordinated entry are often referring folks to us that we think need a higher level of care than we can provide or can reasonably be expected to provide in an independent setting. And, you know, as I've talked to some of you about, is like my deep belief is that there needs to be a much broader range of housing settings and more individualized referrals into them than our current system allows us to do. And Margot could probably go deeper on this, but the challenge we've got now is we're being referred folks who often need medication management into independent permanent supportive housing, and we don't have either the rights or the ability to do that with residents. And so folks don't want to be on their psychiatric medicines. They don't have to be, and that creates risk for both residents and staff. And so I guess the question I'm trying to get at broadly is, you know, do we really have the broad range of residential options we really need to make appropriate referrals for the folks that are moving through this system? And I think, how do we assess whether we have that diversity? I know we don't have the supply, but even have we even identified the diversity of types that we're looking for? I'm not convinced we're all speaking the same language, and my vocabulary is pretty limited by my life in affordable housing. So that's my broad question. And then as it relates to Action Area 4, just as I noted, I think that the clarification, the additional measures is too broad. So I think we just have to figure out what we're really asking. Thanks.
Great, thanks, Doug. And yeah, just I think, you know, I summarized on that slide, I just said permanent housing, but there is more description in the action plan, and we'll make sure to make it sort of more specific about what the permanent housing is that we're talking about in that section. But I think to your point, it sounds like finding a way to measure, right, like what, not just, you know, a total number of permanent housing units, but what types of units, right, are appropriate for the folks that we are serving, and how many sort of those each individual types is needed, and not just like lumping it all together as, you know, one thing. Is that sort of what you were mentioning in that second piece there?
Yeah, Cody, and I guess I would just say, I think we kind of probably have a couple categories that, based on your background on this call, if you're a clinician, you've got one way of calling it. If you're, you know, a developer, you might have a different, but just like, how do we find terminology that both we and the legislators or the council members are using, so we're really clear on what we mean? Because I think we're sort of confusing each other by using the same term for a lot of different things.
Got it. Great, thank you. Great, Margot.
I certainly have things I could say to what Doug said, but maybe I'll go to just what I was raising my hand about. A couple things. I worry in the unsheltered homelessness that we're not even at the point where we know what we know. Like, we don't have a great sense of how often we're assessing people, if we are actually counting people who are unsheltered, if we recognize if people are engaged in coordinated entry. I worry, and then that sort of comes into area 5, which is prevention, which maybe this is my medicine mind, but we would call that secondary prevention. So all of the prevention items are actually like prevention of people returning to homelessness who've exited homelessness. Super important. And actually, if we had a limited number of dollars to spend on prevention, that's where I would spend it, because you always want if you've got limited dollars, to go to the highest risk folks, and those are the highest risk folks. But the problem is, since we don't know when someone moves into their car, like we have no idea when, like we call a lot of things in HDIS exit to permanent housing, which means everything from you're going to a permanent supportive housing with assertive community treatment, and you're going to have a touch point daily, and we know exactly where you are, to you're going to your brother's for Thanksgiving, and you may be there for 2 days. And it all gets sort of lodged often pretty similarly. So I guess for for us, you know, when we think a lot as like researchers of how we know if the prevention programs that we currently have are working, I have to tell you, in New York, it's pretty easy, and in California, it's impossible, because we have no idea when people move into their car. We have no idea when someone goes into an encampment, and it makes any sort of assessment of whether things are working really hard. So to me, I would just be really basic for unsheltered homelessness. Like, it seems like having as a goal better ascertainment of who is entering homelessness, how long they're there, and then where they're exiting to. And if we actually knew when people were entering homelessness, it would help us a lot to know whether that exit is durable or not. Because otherwise, I'm not sure how you know if an exit is durable if you don't know when they return to homelessness.
That's super helpful. Thank you. And just as a note too, right, we're happy to take any other feedback after the meeting too, if things are coming up, or if things are like you want to explain in more detail, right? Feel free to, you know, respond via email. We can always take comments into consideration that way too. If there's like ways that you would specifically change language, or, and Margot, not this is necessarily related to what you were saying, but just like there are like specific pieces or ways you would word things to make them more effective, or acknowledge the gaps that exist right in the current available data, or what we would need to do to get there. Happy to hear that as well.
You know, Cody, if Alex doesn't mind, I wanted to add to Margot's point about Area 5 and prevention, because it strikes me that the recommendations there are actually more along retention as opposed to prevention. And I think there's been a lot of political dialogue around the notions of prevention. And I think there are some things that we can at least measure, such as, you know, diversion programs for folks coming out of an incarceration situation where they're being provided an opportunity to be housed where they otherwise would have ended up being homeless. So I think there can be some measures along those lines, and I don't know if it's a matter of breaking this part into two pieces where there is retention versus prevention. But I think we can measure some of those things, and I think it would be important.
Agree completely, Sean. Thanks.
I see Dora's agreeing in the chat as well. Great, Alex.
Thanks, Cody. I agree with those points as well. I wanted to just go back and echo Sharon's point earlier about the piece in the unsheltered section around, you know, the wording around like expanding kind of the count here. I just want to urge caution around like necessarily expanding the, you know, count of who is considered homeless without necessarily expanding the base of resources to actually serve those folks. I just want to urge caution there, because I think let's capture as much data as we can. Let's better understand these populations, but you know, expanding the definition of homelessness does not necessarily mean we're expanding the ability of our communities to serve those folks with adequate resources. So that's one piece. Other piece, I'm not in the weeds enough in HAP anymore to know if this is an issue, but one thing I've heard is a challenge with how PSH placements are being recorded through HAP, and that they're not being recorded necessarily as exits to permanent housing, but are being considered exits from the system, and that is leading to communities kind of having their permanent housing numbers kind of being undershot. I don't know if that's something that's been rectified. I know that was an issue in earlier rounds of HAP, but just wanted to know if that had been brought up in the work group at all.
Anyone from that group want to respond to that?
We didn't experience that in our community. If they exit to permanent housing, they exit to permanent housing. It'll say like with subsidies, or in HMIS, it's very detailed about the exits. But I do want to learn more about the communities that are experiencing that, Alex. So always wanting to listen, and also excited to see you in the upcoming weeks. And while I'm here, I want to talk about the issues about the point in time count, because the point in time count gives me a lot of anxiety. One of the things that is concerning about expanding to include hospitals, while I do agree that there are definitely people in those institutions that should be counted, the issue that we've experienced in our community, because we used to count them, is that hospitals are not mandated to provide that information. And with the transition of staff members that can die over time, right? Their willingness to participate. It's the same thing as we were engaging with the McKinney-Vento students and really trying to parse out are those students that were HUD defined. But then when that changes and you don't get such partnership, it actually creates this dynamic with your point in time where you're not comparing apples to apples. So that would have to be like a federal or a state level requirement for hospitals and jails and everybody else to participate. Otherwise, your point in time count won't be comparable over the years.
Yeah, thank you for that, Roxanne. And yeah, maybe there's a piece of the recommendations relating to sort of acknowledging what challenges or what challenges we face in the data collection or the use of the data, or something, that doesn't even need to be necessarily in the recommendations, but in our reporting of data, right, to include that and make sure that we're discussing that. Sorry, Megan, I see your hand.
Well, I mean, Roxanne kind of set up what I was going to say. I had a couple different things, but I do think the PIT count is the elephant in the room. And I'm curious, I didn't work on this work group, so I want to respect their work, I'll apologize in advance if there's people on this committee who are huge fans of the PIT count, but I'm not. I think it's not been helpful. And I think that it's starting to become kind of a barrier to our work. So I wouldn't mind if there was enough will to be more bold about, I mean, how useful is the PIT count to us at this time anymore? How much confidence do people have in it? I totally agree that when we start adding populations, which maybe we need to do or look at, it just messes up all your past data. So I have similar concerns that Sharon did about the expanding the count of people experiencing homelessness to include people. It's not that it's untrue that there are people experiencing homelessness in hospitals and jails, but bringing that into an already deeply flawed counting system that we have gives me pause, because our current PIT count is so, having volunteered on the PIT count for a couple of years and like sort of responsible for it in our community, it makes me very nervous because I know what's happening actually on the ground when you're counting, and it's a really, really imperfect system. So I feel like I'm not sure if this committee feels like being more intentional about that. And I think it was interesting in this performance measurements. I don't think we even mentioned the PIT count, but that is the primary tool people use. So it feels like it needs to be acknowledged in some way. The other smaller elephant in the room, but for me, it's I don't know, it's equal size, but maybe smaller, is the coordinated entry system. I also feel like one of the speakers earlier brought that up. Also a really imperfect tool, possibly counterproductive in our community. I get very frustrated because we do not have good Spanish speaking access to our coordinated entry system. So we are building inequity into a system we are forced to use. It feels very wrong to me. So I think that analysis of racial disparities on Action Area 4, there was analysis of racial disparities in access to permanent housing, I would say, and our coordinated entry system, because I think there's a lot of work to be done there. So when we tie ourselves to systems that are inherently flawed, like the PIT count and coordinated entry, we're being counterproductive, in my opinion.
Yeah, great. Thank you for that, Megan. We can definitely add that in there as part of that comment. Charlene, I saw you unmuted.
Hi, yes, thank you, Cody. So I wanted to comment on two areas. I also want to echo what was mentioned earlier about our ability to offer different levels of housing based on the acuity of what we're seeing when our residents come into permanent supportive housing. We're providing housing for transition age youth. Many of them have aged out of the foster care system or the justice system. and they bring a history of generational trauma, generational poverty, issues with around substance abuse. Many of our young girls have been trafficked, and oftentimes they're having they need higher levels of mental health, substance abuse, more supportive services. They're not always appropriate for permanent supportive housing, but yet when we have, when we're following the housing first model or the harm reduction model, as far as using intentional practices designed to lessen the negative and social, physical consequences associated with some of these behaviors, it's not enough to really make sure that we're keeping everyone in our housing safe, especially when you have children in these permanent supportive housing environments. So if that's an area that we can have further discussion, I'd like to recommend that. And then secondly, as it relates to measuring performance measurements, I see that we have some measuring around how many people are being housed, but I'm wondering if we should measure more of our successes as it relates to homelessness and housing, such as how many individuals are we getting to complete their high school or GEDs or to vocational training? How many people have actually completely exited permanent supportive housing? So how do we celebrate more of the different type of successes we're having, because many organizations are leveraging so many resources and opportunities that we bring to our residents. They're benefiting from it and exiting the system altogether.
Thanks for that feedback, Charlene. Appreciate it. Mariah, I see your hand up.
Great, thank you. I started writing it in the chat, but it's easier if I can just explain it. So as an individual representing our tribal communities and our tribal designated housing entities, I have a huge problem with quantitative data because tribal members are historically undercounted. And when we talk about homelessness, the very top of the conversation needs to include the first people of this nation that were homeless. Right? Homelessness began with the termination of tribes and relocating them off tribal lands. So quantitative data is really, really hard for me. There's 110 federally recognized tribes in California. We have 5 here, or we represent 8 at Northern Circle alone. That's such a tiny fraction. And someone said earlier that Doug, I believe it was, that the definitions aren't across the board, right? They aren't across the board, and the definition of homelessness does not fit many BIPOC communities, especially tribal communities. We have individuals living in storage containers. We have individuals in carports that have been closed in, and to them, they're housed. They don't realize that they're experiencing homelessness because that's not a historical term, right? If they're living on Auntie's couch and there's 15 other people in a 2-bedroom house, that's home to them. Who are we to say that they're not housed or they are homeless? So I have a really hard time with the performance measures, because unless we can isolate and do culturally significant and trauma-informed and historical trauma-informed as well, data collection, I don't think tribes will ever be accurately represented in any kind of quantitative data. But I'm looking forward to working with everyone in this group to have solutions. We all have the same mission, right? That's to mitigate end homelessness, and a lot of that comes down to healing trauma and starting at the root. So thank you so much.
Yeah, thank you for bringing that up, Mariah. Do you, just as a question to you, and if other folks have follow-ups as well, right? Like, do you think that from what you're saying, right, there needs to be sort of an acknowledgement of the way that we're measuring might have to change depending on sort of like the culturally appropriate needs of communities across
Absolutely.
California? Like,
one of the things that we try to address here in Mendocino County, and Megan can probably speak a little bit more to it, is we would like to see drop-down menus that expand farther than are you a Native American, right? Because we are a tribally designated housing entity, and we did over $12 million in emergency rental assistance program. We outserved the state of California through our emergency rental assistance program. And if there was a way that HMIS can do a drop-down menu to say that this member is a Hopland Band of Pomo Indians member, rather than waiting in line to get service, they could have came to us and we could have helped them directly right away. So it's doing a disservice to the members by having them put in the back of a line just by checking the box. Now, if there was a way that in statute or regulation that every single HMIS system, until there is a tribal specific coordinated entry or continuum of care, that that there's a drop-down menu where that tribal member can be directed to their tribe where they can get services. Not only does that lessen the wait time for all your other people waiting for vouchers, but that gives that member almost streamlined opportunity to not just housing, but there's cultural benefits, right? Perhaps this member doesn't know that they can do fatherhood and motherhood is sacred, where they can better themselves, or if they're experiencing substance abuse, that they can start participating in culturally significant and meaningful red road opportunities, or their tribe can pay for them to go to a transitional system, whatever it might be. We are doing tribal members a disservice by not allowing and expanding that referral process. It's a westernized approach to really just go to, oh, go to the county, they're going to help you and solve you, and you'll just be number 1,863 on the waiting list, when you could be number 12 or 25 or 125.
Okay, that's really helpful. Thank you. We will make note of that. And again, just, you know, if you have that specific language or recommendation about how we talk about that, I would love to get that so that so we don't mess up the translation.
A tribal specific study that does not just focus on quantitative, but qualitative, and addresses the state-sponsored genocide of a group of folks.
Thank you. Okay, we're gonna move to Sam, whose hand I see next.
Hi, yeah, at the risk of not saying the opposite of what Mariah did, but and acknowledging the challenges specifically that really do exist on the quantitative side around tribal members. I wanted to focus my comments on the permanent housing and the bullet point around the analysis of racial disparities in access to permanent housing, and how limiting just looking at access is, and how it really needs to look at things like retention and housing quality and speed to housing, and all of the other pieces that oftentimes might be indicators of the ways in which discrimination in the private rental market are bleeding into the systems that we have that are very reliant on the private rental market. And then I would also just add that I would expand that beyond just racial disparities, but to look at gender and gender identity, sexual orientation. We just completed a study in LA on women experiencing homelessness as individuals. And one of the primary reasons that the most commonly listed reason that they left permanent housing was safety concerns. And so like capturing information about people's safety in housing and why they might be exiting permanent housing across those just different measures, race, gender, sexual orientation is really important.
Thank you, that's helpful. Charlene, I see your hand up, but that might be from before also, so let us know if you have another comment. I think it's from before. So I'm gonna go to Doug, whose hand I see. Great.
Yeah, I just wanted to acknowledge I think we do need a baseline for both jail and prison populations beyond just folks that have gone into those systems homeless, because a lot of people lose their housing once they go into jails and prisons, frankly, and I don't know very many that have retained their housing, especially in the prison system. You have 900,000 people that go into the jail system annually, And you have over 35,000 that leave the prison system annually. And so to not capture that data from folks that are not custody staff, because that data is only captured by custody staff right now, and the systems are designed where people aren't going to disclose their homelessness more than likely because of the vulnerability and the risk of not being released or given a parole date hearing. So it's just really important. I would actually push against that and say the opposite, that if we're going to change policy, we do need to have a baseline of those that are experiencing homelessness in those justice systems.
I think, thanks for that, Doug. And I think that relates to one of the points made earlier around, understanding, if we're talking about prevention or stopping people from exiting those systems and into homelessness, right? Understanding how many people are at risk of that. So I think that's a helpful comment. Thank you. Chuck, I see your hand.
Yes, thank you. This whole discussion has been, the last few minutes, been very interesting in terms of the need for accurate data collection. It just, I think, for me, high points how important it is to have accurate data in developing policy that's actually effective. Back to the PIT count, I completely share the concerns about the imperfection and flaws in the PIT count system, but I'd also, I guess, remind everyone that it really is become somewhat institutionalized in how we define homelessness in California and across the country, and perhaps scrapping it. And I know that's not what's necessarily being suggested. I think there's just a frustration in the system, but perhaps a lot of these recommendations we've heard now recently are ways of either perfecting the system until we have an alternative, or working on somewhat of an alternative that could substitute in a way that's more meaningful. So I just I don't know that I have a complete recommendation here, other than that it's all we got at this point in time, and I think maybe perhaps focusing on how we can improve that system might be a very solid recommendation going forward.
Yeah, so maybe identifying areas of that system that need improvement, or data that maybe was once collected in the PIT count that is now collected in either HGIS system or in other places where we may think data is more accurate, based on however we define that word, which I know is complicated. But I think recognizing where those systems need to be improved is important. Thanks, Chuck. Joe, I see your hand.
Yes. Yeah, thanks, Cody. As someone who works with many continuums of care throughout the state, I just imagine myself thinking, well, okay, even some of you that are, some of us that are on the call are, work with or are part of continuums of care, and what are continuums of care saying when they hear all of this, And so I just want to say this, that, when we talk about the PIT and we talk about the CES and we talk about HMIS, and even when we talk about racial equity, you got to remember where COCs were if we turn back the clock to prior to 2018. COCs prior to 2018, when it came to the CES and the HMIS, and all of that, they were establishing those systems, and we're dealing with people who pretty much had HUD funding, and pretty much only HUD funding, maybe a little DOJ, a little SAMHSA, but mostly all of that. All of a sudden, the state comes along and says, hey, 2018, there's HEAP funding, and there's CASH, and there's HAP, and there's round 1, and there's round 2 HAP, and 3 and 4 was due by June, last few months ago. And all of these agencies that are now receive these fundings are now part of, because what the state is calling for and in legislation, to be part of the CES, the coordinated entry system, to be part of the HMIS. And all of a sudden you have many more agencies, and these systems have grown, tremendously, And so, one of the things that we have to be very mindful of, and thus the council needs to be very mindful of, and I feel that we need to say to the council, is that, hey, if there's anything that we really need from the continuums of care, we should first ask, you know, is there something that you're already doing that can accomplish what we need? You know, whether if it's system performance measures, whether if it's the, you know, the HMIS, you know, is there something that you're already doing, you know, that we can accomplish? Otherwise, you continue to add, you know, we don't want to wind up adding more and more to the workload for many of them, because they're pretty much overloaded, and that's without exaggeration. And then also, again, I mentioned a few times about when we think about this, is also to pull HUD into the conversation too, you know, and say, hey, you know, we're thinking of this, and, you know, we want multi-year funding, and we hear, HUD, that you guys are thinking about your COC multi-year funding. You know, maybe we should, you know, make sure that that doesn't overload the COCs, you know, do it in such a way. So I'll stop there, but I just feel like I wanted to bring that to our attention.
Great, thank you, Joe. I appreciate that. Rita?
No, almost, I may have forgotten what the original question was, but what I haven't forgotten is how I am feeling, what I am currently experiencing. No, and it's interesting because there's so much data that has been proven data, and one of them is across the California, in every single county, there is an overrepresentation of Black people. Now, I don't know if I need to say that again. I kind of want to. There is an overrepresentation of Black people who are unhoused across California and every single county. And yet, it's a conversation that doesn't seem to be had enough to a point in where we are looking at how do we change that data? Because it's a data that is very hurtful and painful to so many, because it's not just about Black folks being overrepresented and being unhoused. It's about the criminal justice system. It's about the child welfare system. It's about the foster care system. And I mean, we can increase the list ad infinitum. But I would hope that what would be brought back to the council is to truly look at how do we prioritize in some form of fashion, because we keep hearing, oh, we can't do that. But there's report after report after report, data after data, and how many people or groups do we find that are, I don't know, seemingly disappearing? Because even the percentage of Black people continue to drop. And you know, I just need to be my authentic self in this space and say that we must address it because it's critically important. Enough is enough. Now, can I get some support from other members in this space where Black people, specifically Black folk across California, seeking support?
Thank you, Reba. I really appreciate that. And thank you for being your authentic self and sharing with us in that way. I think everyone really values that. I think one thing we can do in this, at least regarding these recommendations, right, is to be really specific around, like, you know, who we know is experiencing homelessness and what disparities we know we're seeing. And maybe we have a recommendation in here, to your point, around like, how are we identifying the successful strategies for those folks, right? Specifically those folks. Anyone else have thoughts around that?
How are we ensuring that all of the strategies are working specifically for all population?
Yeah, I love that. Thank you. I don't want to move past this point too quickly either. Does anyone else have thoughts or responses, because I know that, we had sort of a broad recognition of, quote unquote disparities and assessing them across all of the work that we're doing. But does anyone else have thoughts around this specific point?
I don't know what possible unintended impacts of what I'm saying might come out of this, but I do wonder if, and I don't want to use the word punish because it's not the right word, but if there should be, so in terms of performance measurements, if somebody's operating a program that does not accurately reflect the racial equity that should be expected, if there's either a bonus or a what is it called? What's another word for punishment? But I mean, some sort of, you lose points or something like that. I mean, we do look at our programs in our community and we're like, look, this one's, racial equity balance seems pretty off, but there's no consequences for that. We just sort of note it right now. We also don't reward the ones that seem to be doing a pretty good job on accurately or appropriately reflecting the demographics that it should be reflected in the community. So I don't know if that's too controversial or complicated for people, but we're getting assessed on all kinds of things, and maybe the balance of each project on how it should be, if it's accurately reflecting the homelessness community, should be recognized. If nothing, it sort of makes a statement that it's more important than just talking about, as Reba said. We're doing a lot of talking about this and we're admiring the problem without actually putting teeth behind it. And admiring the problem gets a little tiring after a while.
Hi, Cody. I just want to add, just being a member, I think I attended the first one, and Ludmilla, excuse me 1 second for jumping in. One is when we talked about racial equity and people with lived experience or lived expertise, I think we wanted it across all of the domains, and we're trying to figure out how to capture that. And then looking back, and thank you both Mariah and Reba for raising those points, because we missed it, and we need to look at on all of the performance and every step that someone goes from being unhoused to being housed. Where do we measure the equity? Where do we look at racial equity? And where do we look at our people with lived expertise included in those decision-making processes? So I don't know, Cody, if that could go to one, if we can tighten up where it says strengthening the systems, where we could kind of call it out more there. So that way it's implied for all the other sections too. Thank you. I'm sorry.
Yeah, thank you, Elise. I appreciate that. Ludmilla, I see your hand as well. I don't know if it's related to this or separate, but feel free to, whatever your comment is.
I was kind of continuing with different things on the performance things, on the summary, but I just wanted to say kind of excellent leading where a huge point came up and you just kind of went off and expanded for that. It's totally, I love the way you handled that and are continuing. But so I definitely want to hold back if there are more people that want to speak on the point that Reba brought up, because what I was going to say is different. It's a different point. Okay, so or should I go ahead or did you want to continue? Let me know either way.
Say, Alex, did you have a point on this?
No, I was just gonna agree with Reba. I don't see why racial equity measures shouldn't be an outcome measurement that grantees are held accountable to the same way that they're held accountable to other measures. It doesn't mean that a homeless system necessarily then has to be responsible for all of the inequitable racist systems that are driving people into homelessness at disproportionate measures, right? But they should be then making sure that they're delivering services in an equitable way. And there's ways we can measure that and ways we can report that and ensure that that's, the same as increasing your permanent housing exits, as, preventing homelessness, is doing all these other things that, in the past have been HAP performance measures, for example.
Yeah, thank you, Alex. So it sounds like there's a question of like, yes, measurement, but also like, how are we building in accountability with that measurement, right? And I think maybe that goes to these recommendations, but also the recommendations that we were talking about before around programs and funding, right? And if we're talking about like making those programs more effective, part of that might be the accountability that has been brought up a few times now around like, you know, not only measuring who is experiencing homelessness and at what rates, but also saying like there are things you must do to serve those people and make sure that all of your programs are serving those people effectively. So I really appreciate that. Thank you all. Any other points on this before I pass it back to Ludmilla? All right, Ludmilla, take it away.
So on page 4 under action area 5 of prevention, okay, just assessment, it says of costs, and that could be kind of misinterpreted. Really, I think assessment of the value of services that are actually received by clients through services or actual time spent with clients, measuring that somehow. And I'm not sure how we're going to get there. You know, I sort of randomly, well, not randomly, but there's like some client feedback forms that would be possible that various people, and I've heard various people talk about at various times. There's grievance forms, but there's also success forms as far as how people are doing is some kind of form interaction. I'm going to say one of the biggest complaints that I hear again and again and again from people who are homeless, trying to recover from homeless, is that the services aren't actually reaching them. There's talk, there's coordination, there's facilitation, there's consultation, there's consultants hired, there's strategic plans, there's, you know, but they're still sitting there without a drinking fountain that they could refill their water bottle from. You know, there's not, you know, they're still sitting there without somebody that they can talk to about mental health issues. They're still sitting there without a coordinated social worker that is helping them navigate, that's a consistent person that can help them navigate. And so that actual, some way of measuring, even if it's imperfect at first, because we're not doing that now that I can see, is having measurements of that actual connected time with a person who is experiencing homelessness, and or the results that a person that a client, a person experiencing homelessness is experiencing, the benefits that they're receiving in terms of services and housing, but also additional services that go around that. I'm going to say the biggest thing that I see homeless people being targeted for is the amount of money that's spent on homelessness, you know, and it's great that there's all of these things that have so much potential, and absolutely some things are happening, and some sort of, but measuring that actual service, how much service has actually been received. I'm kind of thinking, and I don't mean to be hurtful at all about this, but you know, there's a kind of a little metric on charity donations and stuff like that. When you make a donation, how much of your donation actually goes to the people being served and how much goes to the administration there, you know. And if we as a homeless system, and I am part of the system as much as the rest of you at this point, if we were to measure ourselves on that percentage, it wouldn't be a beautiful number. And it's a hard issue to look at that, but I don't want to make it too hard. I do want to say that just getting feedback from people on the ground, getting feedback from either from clients and or getting feedback from people who actually work with clients. How much time did they actually spend connecting with clients in the field? I've heard too many stories of caseworkers who spend time on their paperwork and whatever, and aren't actually out there interacting with the clients. How much of that time is actually interacting with clients? I think I made my point about 5 times over here. But anyways, that's just the language on that. So it's not so much the cost of the service as the value of the value of it to the client, the benefit there on that one line under on page 4. Thank you.
Thank you, Lynn. I appreciate that. And thank you for summarizing at the end as well. That was helpful. So I'm gonna pass it to Megan because I see your hand is up, and then I'm gonna move us forward because I want to leave time for public comment. But so let me pass it to Megan first.
That's okay. In the interest of time, I'm okay.
Sure. Great. All right, well, thank you all. This discussion is super helpful, and I just want to give a shout out to the group that helped sort of start these recommendations, right, and put them together, discuss them so that we could have this discussion. This was a really, really great engaged discussion, and I think there's a lot that we've heard here. So I'm going to go a little bit off book for a second, because it seemed like just reflecting back, right, in the first set of recommendations, there was some commentary, there was some questions that we want to ask, right? But generally, it seemed like we were good to move forward. I want to say, like, there is not a statutory requirement for the committee to present these recommendations to the council at this next meeting. So if for this set of recommendations, we want to spend more time, like, I think my team is gonna, after this meeting, spend a fair amount of time with the comments that we've heard, try and summarize them, bring and like really put them together and add them to this list. But I know there was a lot, and so I want to see what people are feeling around sending this to the council, right? So just as a time frame situation, materials are due to the council on Friday, August 25th. So to get materials to the council on time for them to read, and have some time with them, we need to have it by the 25th. So I just want to see, does anyone have thoughts about wanting to look at this again before we send it to the council, or, moving it forward for this September meeting, or waiting and helping refine or keep discussing? This is all very much up to the committee here. So I don't want to make that decision for you all. I will say this discussion and these recommendations are going to be really helpful as Cal ICH works to sort of revamp, revise its action plan. We're doing a revision now that is more just adding activities for this current fiscal year, but in coming up very soon, sort of in the fall, we're going to be working on looking at the action plan and seeing sort of structurally how we want it to look over the next 3 to 5 years. So these recommendations are really helpful for that process, but that isn't necessarily like starting until, or we're not going to be super in that process until for a few months. So just want to put that out there, see how people are feeling. Chuck, I see your hand is up.
You actually have kind of landed in an area that I was going through my head as we were talking. This has been a really, I think, fruitful conversation, but there was a lot of stuff to digest today, and I just I think it's a great idea to perhaps push this off and get another. I'd like to get another look at whatever the staff has refined. So I would at least make the argument that if we're not losing critical time in any way, shape, or form, it might be better to work on this document a little bit longer and make sure it's ready for prime time.
And just to clarify, Chuck, are you referring to the whole, and this is my fault for not being clear enough, the whole document, including both sets of recommendations, or the specific half of the recommendations related to the performance measures?
I would go along with both, but I do think we're a little bit further along on the first than we are on the latter.
Okay, thank you. I see an agreement with Chuck on the performance measures in the chat. Anyone else have thoughts on this?
I would agree on the performance measure piece. I think on the funding and implementation, it felt like there was more consensus already, but around what was in there. But that's just my 2 cents.
I agree with Alex. I think we're ready to go on the first piece.
I'm seeing agreement in the chat. Okay. Does anyone disagree? Does anyone feel strongly like this needs to go now? Performance measures, we're ready, let's do it. It's okay to disagree. Or any clarification or additions to that. Okay, I think that, so we'll talk about it, we'll sort of reconvene as a team and follow up with sort of what our process is gonna look like. It sounds like we're good to go sort of with the first piece around the funding and programs and providing those recommendations to the council, and maybe, you know, a summary of what we discussed or what our process has been around the second piece around performance measurement, but that we're going to continue to work on that. And we will convene folks once we sort of have what you all talked about today in written form for you to respond to. Because I think this is a very complicated discussion, and I really appreciate everyone's engagement and want to make sure we get it right and feel good about it. So thank you all for the calling the audible with me and working through that. All right. So I am now going to pass it back to Giselle to facilitate public comment. And we will go from there.
All right. Next slide, please. We will now accept general public comments. Thank you all for your patience, and we appreciate our committee members as well for listening to these public comments. We welcome all comments and feedback. I'd like to remind everyone that we are unable to discuss items that are not on the agenda for today's meeting. Additionally, due to the structure of this public meeting, we will not be able to respond to any questions. If you have any questions for CalICH or the committee, the best way for you to get a response from us is to email us at calich@bcsh.ca.gov. Everybody will get 2 minutes for their comment. A CalICH staff member will soon share a screen with a 2-minute timer countdown, and will warn you when your time has expired. If you're connected through Zoom, select the raised hand icon in the meeting window on your computer, and we will unmute you. For those joining us by telephone, you may press *9 to indicate that you'd like to comment, and you'd be instructed to unmute yourself. I'm going to give it a second to see if there are any hands raised. Currently have one from Rich L. Rich, you may voice your comment.
Hi there. Thanks for letting me join you all in your meeting. Very good meeting. In general, these meetings are very important for the homeless, for the people who are unhoused, moving them forward. But I believe that it is critical that we are looking to basically work yourselves out of a job. And that is to have a long-term goal of maybe 5 years, just an arbitrary number, where it's not a short-term thing, but it's not too long or never ending. Because I believe that once you have a goal with an end date, you're really going to look and try and make sure that you hit that goal and make sure that you're constantly checking your objectives to make sure everything is in line for the best result. The young lady mentioned about inclusion of all people, including African Americans. Too often, the things that we're working on, if you don't have a person at the table, you don't have a person in the room to bring up these issues, they don't get addressed. So I won't say more on that, but it's a big concern, and we really want to be working for a solution more than we want to work toward having meetings and having meetings and having meetings. We've got to have something that's objective that we can call an end to, and then we move on from there. And thank you for taking the time and all your volunteering.
Thank you, Rich. I'm going to give it a couple more seconds, see if there's any other hands raised. Okay. We have Lahela Maddox. Lahela, you may voice your comment.
Hi, thank you. My name is Lahela Maddox. I'm the Chief Operations Officer for the Regional Task Force on Homelessness in San Diego. We are the continuum of care for the San Diego City and County. And I think I just want to sort of compliment Joe Coletti's statement around the COCs. Of course, I have lots to say, but I'm just going to limit it to this. Just based on the conversations, a lot of these things are tied to federal mandates of a COC that are currently unfunded by the state. And so that puts a lot of burden on the COCs. Our funding is stagnant from HUD. So I just think we have to be careful about what the state wants to do and requires of a COC versus what we are required to do by HUD, right? And then we start to layer on top of that. So that just concerns me around things that you are wanting to do, and it doesn't mean that I agree or disagree at this point. I just want to kind of blanket that I think the committee and the council need to just be cognizant of what COCs are federally mandated to do, and then what you might layer upon that, and then what is funded, what the COCs are funded to do. So I appreciate the time and the conversation that you all had today, and look forward to hearing this being brought forward to the council. Thank you so much.
Thank you for your comment. I'm gonna give it a few more seconds. All right, I'm not seeing any more hands raised. Thank you for everybody who commented. If you have if anybody else has any comments or any feedback for us, please feel free to send us an email and we can share that feedback as well. All right, I'll pass it back to Cody for final remarks.
Thanks, Giselle, and thank you all again for the conversation today. So I know we only have a couple minutes left. I promise to get us out of here on time. But before we close, I just wanted to follow up on one other topic from our last advisory committee meeting, which is this group's charter. Maybe this feels like a long time ago now that we discussed this. But as you all saw in an email, we made sort of, minor edits to the charter based on your feedback during that meeting. We plan to send back the final version to you after this meeting and post it on our website as well. And as a reminder, sort of the decision on the committee member terms was that terms started technically July 1st, 2023, and will run for 2 years with an option to be reappointed for another 2 years. So that's all spelled out in the charter. So feel free to take a look and just let us know if you have any questions once you see that. But yeah, just again, thanks to all of our committee members for your insights and your comments during today's meeting. I think, as you can see, we're working hard to move the committee towards actionable work and recommendations that go to the council, and we're only able to do that because of your thoughtful input and attention to this work. So appreciate that, and hope to continue that at our next advisory committee meeting, which will be on November 6th at 1 p.m. Should all have that in your calendars. If not, let us know. And just want to also thank the members of the public who attended this meeting today. We really appreciate your interest and participation in our work around homelessness. And I know a lot of you who attend our meetings work to address homelessness either in the state or in your local communities. So we appreciate all of your efforts. And we hope everyone will either join us in person or listen into our council meeting on September 7th at 1 p.m. So with that, I will adjourn the meeting at 2:58 p.m. Here's the information for how to get on our contact lists. Please sign up if that's relevant for you. And everyone have a great rest of your afternoon.